Welcome back at 8:14. Birth defects are structural changes present at birth that can affect almost any part of the body. We're raising awareness and highlighting the efforts to improve the health of people living with these conditions. Joining us this morning is Dr. Arelis-Bruno from Toro Hospital to talk more with us this morning on this National Birth Defect Prevention Month. Good morning, Dr. Bruno. We appreciate you being with us.
Good morning. Thank you for having us.
So let's first talk about how common birth defects are in the United States.
Well, around 120,000 babies are born with birth defects every year. That means roughly 1 in every 33 babies will have a birth defect.
And let's talk about the identification process. Is this something that's happening both before delivery and during and even afterward?
Correct. Most birth defects are found when the mom is pregnant or within the first year of life. Some of them you can see, some of them you find out later with special testings.
And talk about some of the ones that you definitely can see right off bat without having to do testing.
Something like a cleft lip or a cleft palate you could see. Something like a heart defect or hearing loss will be something that you will evaluate in the first year of life.
And I know this is a kind of a long answer to this short question, but what are some of the causes of birth defects?
We really don't know. We think it's a mixture of factors, so genetic conditions or genetic disposition, environmental factors, and some behavioral factors can affect our chances or increase our chances to have birth defects.
And so when we talk prevention, let's, I guess, start first with behavior. You can't control your genetics and you can't control some other things happening during the pregnancy process or during pregnancy. But as far as behavior of the mother's concerned, what can a mother do to try to prevent birth defects or not?
Well, if you think that you want to get pregnant, don't drink, don't smoke, stay on top of your preventative care. This is what we do here at Toro and at Crescent City Physicians. Set an appointment with a doctor to create a pre-conception counseling so we can look at what your behaviors are, your genetic, your medication, so we can alter those things when you think you're trying to get pregnant.
The counseling you mentioned, I don't think many people even know that's an option. Can you tell us more about that a little bit?
So you can schedule a pre-counseling appointment with any primary care provider or even your gynecologist when we look at your medical history, your family history, your current medications, and assess if there are any risk or any modifications that we want to make before you even try to get pregnant or if you're considering getting pregnant.
And that's just so interesting that that's even an option now for parents, and that parents really need to take advantage of that if at all possible. Anything else you want parents again, or mothers to be, fathers to be out there to know, especially this month, this National Birth Defect Prevention Month?
Well, the more information that we have, the better care that we can take care of each other and our, offspring. Involve your partners as well and your family members. If you want to create a preconception counseling, bring the people closer to you. They may have some questions that you may not think, and we are here to help you seek those answers.
And if you're bringing a parent or another relative, they may have some answers to that medical history that you may not have right off the top of your head. Dr. Bruno, we appreciate your time this morning. Thank you so much.
Thank you for having me.